If you've spent any time online lately, you've probably heard the term Ozempic or Ozempic face. So these GLP-1s are really incredible, including Ozempic and Wegovy. They're helping people get to their healthiest self by losing weight. But we are also seeing a lot of fat loss in the face, which is not ideal. So today we're going to talk about what's really happening and what we can do about it. So let's start with the basics. So GLP-1s like Ozempic, Wegovy, Mounjaro, these were developed for people with diabetes. So what these drugs do is they regulate your blood sugar, they slow down your digestion, and they reduce your appetite. And ultimately what happens is significant weight loss, which is pretty cool. And so for many people, this has been life-changing, not only for their health, but for their confidence. But let's talk about the dark side now. With rapid weight loss, you can lose fat in the face too, which is where that term Ozempic face comes from. So then the question is, what can we do about it? What I see in my clinic are people with skin sagging, with gaunt faces, and they're not happy. They feel aged. So these patients are coming to me to see what they can do to improve their overall appearance because they feel great with the rest of their body, but their face now all of a sudden looks aged. So a lot of our discussions tend towards revolumization. So that means replenishing some of those decreased fat pads in the face, but also tightening the outer envelope. So that's the skin. Just like a balloon, when a balloon is very stretched and then it reduces in volume, that outer envelope gets a little bit loose. So a lot of our conversation involves skin tightening procedures, and we do a ton of those. So the three most popular treatments that I'll use for someone with Ozempic face is going to be revolumization with a hyaluronic acid filler. I do oftentimes radiofrequency needling, which is a topic we should talk about more later. And third, I'll do a lot of lower face, jowl, and neck tightening. A lot of that fat is lost around this area, and so it leaves a lot of loose skin, which we want to tighten up. I specialize in minimally invasive cosmetic treatments, and so a lot of people don't want to have a facelift or have surgery or wounds or sutures. And so using these treatments, you can get by without all the risks of surgery. Using that analogy of that inflating balloon and then improving that outer layer of the balloon. And so that's going to really be the best approach for Ozempic face. Just remember, you're not alone. This is a really popular medication right now, and we have solutions for you that do not involve cutting and suturing and facelifting. There are some great minimally invasive options out there. If you're in the Chicago area and you want to get checked out, give us a call and we'll schedule you right away. And if you want to learn more about skin health, make sure to subscribe to the channel. We'll see you in the next one.